Every year, diarrhea affects over 1.7 billion people worldwide, yet many still underestimate its impact. Today we're talking about diarrhea, a common but often overlooked health issue that can disrupt lives and even pose serious health risks. I have created a fictional character called Alex, who will guide us through today's video. Let's meet Alex. Alex is an inquisitive and energetic 12-year-old who loves playing basketball with his friends after school. But lately, he's been missing a lot of practice because he keeps getting sick with diarrhea. It's really upsetting him because he wants to join his team in their upcoming tournament. In today's video, we will educate you about the causes and treatments of diarrhea, so that you can support Alex in his journey to better health. Let's start by understanding what diarrhea is and why it happens. Diarrhea is a condition where a person has more than 3 bowel movements per day. The normal consistency of poop is like a cylindrical shape, and it's smooth enough to slide easily into the toilet bowl. But when someone has diarrhea, their poop becomes loose and watery. This happens because the normal digestive process gets sped up. Normally, the digestive system breaks down food with the help of enzymes from saliva, stomach acid, and small intestine juices. These juices also absorb most of the water from the food. However, if there's an infection in the digestive system, these juices are unreleased properly, and the food moves quickly through the intestines without being fully broken down. As a result, the water in the colon doesn't get absorbed properly, leading to loose or watery stools. Now let's talk about the different types of diarrhea.
Actually, diarrhea lasts for a short period of time.
Usually between a few hours and a couple of days. It's often caused by a viral infection like a stomach flu, bacterial infection from contaminated food, or other temporary issues like taking antibiotics. On the other hand, chronic diarrhea can last for weeks or even months. Some common causes include inflammatory bowel diseases like Crohn's disease or ulcerative colitis, lactose intolerance, food allergies, celiac disease, bacterial or parasitic infections, side effects from certain drugs, liver disorders, and diabetes. To understand how diarrhea affects people's lives, let's follow Alex as he tries to go to school despite his condition. On Monday morning, Alex wakes up feeling nauseous. He hasn't stopped using the bathroom all night, and he knows that once he goes, he won't be able to concentrate on his classes. His mom packs him some soup and crackers for lunch, knowing that these bland foods are easier on his upset stomach. At school, Alex spends most of his time in the bathroom. He feels humiliated having to leave class so often. He misses his favorite teacher, Mr. Williams, and wishes he could ask him about the quadratic formula, something that's been bothering him during math class. After enduring another uncomfortable afternoon, Alex heads back home, hoping for a good night's sleep before it's time to do it all again tomorrow. For millions of children worldwide, this is a reality that repeats day after day. Diarrhea takes a toll not only on their physical health, but also on their education and well-being. It's not just children who suffer. Millions of adults around the world miss work or important social events due to the same problem. They may feel too embarrassed to discuss it with their colleagues or friends, fearing misunderstanding or losing opportunities. This is why it's crucial to raise awareness about diarrhea, debunk myths, and provide support to those who are dealing with this condition. By doing so, we can help create a world where no one feels ashamed to talk about their health. We need to remember that diarrhea is a common problem that affects so many of us, and open conversations can help us find solutions together. Let's now see some of the main causes of diarrhea. A study published in Clinical Infectious Diseases estimates that each year, over 1.9 billion people get sick from diarrhea related to bacterial infections, such as Salmonella, Shigella, and E. coli. These infections are spread through contaminated food and water. Also, a person can get infected by coming into contact with a contaminated surface or object and then touching their mouth. Symptoms include fever, stomach pain, nausea, vomiting, and diarrhea. You can prevent bacterial infections by washing your hands thoroughly with soap and water, keeping food and surfaces clean, and staying away from potentially contaminated surfaces. Viral infections are the most common cause of diarrhea. One example is the norovirus, which spreads through contaminated surfaces, food, and water. It's highly contagious, and symptoms include vomiting and diarrhea. Other viruses like rotavirus and adenovirus can also cause diarrhea, especially in young children. The best way to prevent viral infections is to wash your hands regularly and avoid close contact with sick people. Food intolerances occur when a person's body has trouble digesting certain foods. For instance, lactose intolerance happens when the body cannot digest lactose, a sugar found in milk and dairy products. People with celiac disease have an allergy to gluten, a protein in wheat, barley, and rye. When they eat these foods, it triggers an immune response that damages the small intestine, causing diarrhea. Moreover, irritable bowel syndrome, or IBS, is a disorder that affects the large intestine. People with IBS may experience abdominal pain and cramping, bloating, gas, constipation, or diarrhea. Certain medications can also cause diarrhea as a side effect. Antibiotics, for example, kill bacteria in the gut that help break down food, leading to diarrhea. Other drugs that commonly cause diarrhea include antacids, containing magnesium, cancer treatments, and some blood pressure medications. It's important to talk to your doctor or pharmacist if you think your medication is causing diarrhea. Lastly, stress and anxiety can sometimes trigger diarrhea. This is known as stress-induced diarrhea. It happens because the body reacts to stress by speeding up the digestive process. As a result, food moves quickly through the intestines, and water isn't absorbed properly, leading to loose stools. Now that we know what causes diarrhea, let's explore how it affects people's lives. In addition to the physical discomfort, diarrhea can also cause stigma and isolation. People with diarrhea might avoid social situations because they worried about having an accident, or might feel embarrassed about their condition. This can lead to feelings of loneliness and disconnection from the ones they love. Furthermore, diarrhea can limit daily activities, making it difficult to go to work or school. This can have serious consequences for employment and academic success. In severe cases, diarrhea can lead to dehydration and malnutrition, which can be life-threatening, especially for children, older adults, and people with weakened immune systems. Diarrhea disproportionately affects low-income communities who lack access to safe water, sanitation, and healthcare. It is estimated that in sub-Saharan Africa and the Indian subcontinent, diarrhea is responsible for over 40% of child deaths. Globally, diarrhea is responsible for 1.9 million deaths each year. This includes both acute and chronic diarrhea. Children under the age of 5 account for 1.2 million of these deaths. If left untreated, diarrhea can cause dehydration, which happens when the body loses more fluids than it takes in. This can lead to serious complications like kidney failure, low blood volume, and even death. To prevent dehydration, it's important to drink plenty of fluids, especially water and electrolyte-rich beverages like sports drinks or coconut water. Now, let's look at how diarrhea is treated. If diarrhea is mild, it often goes away on its own within a few days. Drinking plenty of fluids can help prevent dehydration. Brat diet, which stands for bananas, rice, applesauce, and toast, is often recommended. These foods are easy to digest and can help firm up loose stools. Over-the-counter medications like Imodium or Pepto-Bismol can also provide relief. However, it's important to talk to a doctor before giving these medications to children. For diarrhea that lasts longer than 2 days or is accompanied by a fever, blood, or mucus in the stools, it's essential to seek medical attention. A doctor can determine the underlying cause of the diarrhea and provide appropriate treatment. This may include prescription medications like metronidazole or ciprofloxacin for bacterial infections or antivirals for viral infections. Additionally, a doctor may recommend dietary changes or supplements if a food intolerance or other dietary issue is identified. To prevent diarrhea, it's important to practice good hygiene, including washing your hands thoroughly with soap and water before eating and after using the restroom. You should also avoid close contact with individuals who are sick. When preparing food, make sure to cook it thoroughly, wash fruits and vegetables well, and store food properly to prevent contamination. Additionally, ensure that water is clean and safe to drink. Consider using a water filter or boiling water to kill any potential harmful bacteria or parasites. As we conclude our discussion on diarrhea, let us take a moment to reflect on the importance of raising awareness about this common yet often overlooked health issue. By educating ourselves and others about the causes, symptoms, and treatments of diarrhea, we can help break the stigma surrounding this condition and encourage those who are suffering to seek the help they need. Remember, knowledge is the first step towards finding solutions. So let's continue to learn, share, and support one another on the journey to better health and well-being. Thank you for joining us on this informative journey. If you found this video helpful, Don't forget to give it a thumbs up. Stay healthy and take care.